Hello, good evening. This is BBC London News. A special investigation by this programme has revealed strong evidence linking cannabis and mental health. Doctors in South Africa, which has a blind eye policy to cannabis use, say up to 80% of their mentally ill patients have been addicted to the drug. It comes as the government here begins to rethink the law on cannabis, which was controversially downgraded to a Class C drug last year. So what lessons can South Africa teach London? Asad Ahmad begins this report in Cape Town.
6,000 miles from London lies one of the most modern countries in Africa. Geographically, it's the furthest away from us, but woven in society is a problem which could be getting closer than we think.
Dope, it just takes you nowhere. You get stuck in life.
I became paranoid, uncomfortable, suspicious the whole time.
It's impacted in my life in such a way where I can't do anything anymore.
Cannabis, daka, Durban poison, weed, whatever you want to call it, it's flooding into London. Profits to be made are high, but the impact on mental health can be devastating. I went to meet a leading doctor who works at one of the largest psychiatric hospitals in Cape Town. The patients here have serious mental disorders, and up to 80% of them are, or have been, cannabis users.
I've worked in this field for 20 years. I have got no doubt in my mind that cannabis is linked to mental illness.
But there are those who say that there isn't a link.
I would find that not even conceivable in a situation when one is dealing with patients who are ill or admitted to hospital because of the fact they are abusing cannabis.
This kind of first-hand experience is typical of what many doctors throughout South Africa have found over the years.
This particular report is one of our 6 monthly reports where we monitor alcohol and drug trends around South Africa.
Professor Charles Parry is currently writing an official report, a guide for the government on policy in relation to cannabis in South Africa.
It's clear that there are some quite serious chronic effects of cannabis use. We've also got good data on the link between cannabis and injury, and also cannabis and links with crime, and also sexual risk behavior. So I think there's a lot of reasons for putting cannabis higher on the agenda.
So it seems amongst medical professionals here in South Africa that there is an acceptance of the link between cannabis and mental health. But what about amongst cannabis users themselves? Well, I've come to this rehabilitation unit in Durban to find out more. Here, a lot of the users have got into cannabis in similar ways as to the way they do in London. And I want to find out whether they think South African cannabis has had an effect on them.
Quite available everywhere.
In the centre, there's an atmosphere of openness and honesty. Users reflect on the impact of cannabis. Nobody here thought the drug could or would slowly take over their lives. Outside the classroom, some of the cannabis users trying to give up the drug were keen to share their experience in the hope it might stop others experimenting before it's too late.
It has mental effects, and it takes away almost everything. It takes away your good thoughts, because it leads you on to more, it progresses. The addiction progresses from cannabis to harder drugs.
Living it up at the Hotel California.
It's hard to quantify exactly what cannabis can do to your life. I mean, here I am at university, I'm full of zeal. It's my first time out of South Africa. We're coming out of an apartheid South Africa those years. I have freedom to do anything I want. I have all the books I can read. I can study anything I want. I can go any place I like. And I'm introduced to this thing. And all of that disappears. My focus now is only on is only on the weed.
Durban, on the country's east coast, is the home of daka or Durban poison, a potent strain of cannabis. It's among the most common types making its way over to Britain. This doctor has worked in London, and he believes that cannabis making its way over in such large amounts could have a massive impact.
I would think you need to be very worried about the influx of South African cannabis to the UK, because we've found that the effect of South African cannabis is definitely different from other strains of cannabis. It would appear that the cannabis in South Africa is far more potent and far more likely to cause long-term psychiatric side effects or implications or illnesses than the cannabis which is available locally.
The effects may also be felt by non-users in the form of spiralling health costs.
The cost is, I couldn't even begin to calculate it for you. It's enormous, enormous. And I don't even think that we working in the field probably just looking at the tip of the iceberg. But it's a growing problem here.
Cannabis has become increasingly easy to get in London since the laws were relaxed. Now the British government has decided to review its more lenient approach in light of evidence linking the drug to mental health. As they carry out that review, South Africa provides us with a warning that the cannabis on London's streets could be more potent and harmful than users have ever imagined. Asad Ahmad, BBC London News, in Durban, South Africa.
Well, with me now, Dr. Zerin Atakan from the Institute of Psychiatry and Marjorie Wallace from